Hi, welcome to Module 8. This week, you will actually be concluding the course by looking at the impact. Let's review the learning outcome, and it is actually to reflect on the impact of improved health literacy from a public health perspective. I think you'll find your readings this week to be very interesting. There are actually two case studies which enable you to accomplish the learning outcome, which is to actually review how health literacy interventions, how health communication principles, and health literacy efforts have been used in real time in health systems and communities. Once you review those case studies, and there are actually several there on the AHRQ website, the Agency for Healthcare Research and Quality, which you're going to focus in on one of the case studies, and you're going to comment on the specific health literacy problem that was addressed. Again, that would be clearly described in one of the case studies that you're going to choose. And then you're going to also discuss the strategies and methods that that particular health system or community used to resolve the problem and the improvements. What were the improvements that resulted? Now, as a final summation to this course has aimed to introduce you to health literacy and plain language, both from a theoretical and a practical perspective. As you recall, we began in Module 1 by talking about the 4 overall learning outcomes that would be accomplished at the end of the course. And so, number 1, you have been able to evaluate the population demographic and socioeconomic factors that affect health literacy, as well as healthcare system interactions between providers and patients. Secondly, you've been able to apply an understanding of health literacy in plain language to utilize salient health communication principles and techniques, and then to explain the implications of their misuse on patient outcomes as well as healthcare system outcomes. Thirdly, you've been able to analyze relevant national public health policies, programs, and interventions, all implemented to improve health literacy, patient, and health system outcomes. Finally, you've been able to assess ethical principles involved in healthcare and health education when conducting patient and population level health literacy activities. I'd also like to note that with the submission of your final project last week, you've actually developed your own training workshop that can be used to teach and talk about health literacy among your colleagues of healthcare and public health professionals. So together we've walked through 7 modules. Module 1, understanding the problem from a healthcare system perspective. Module 2, we answered the question, what is health literacy? Module 3, we reviewed national efforts to improve health literacy. Module 4 looked at patient-level efforts to improve health literacy. Module 5 caused you to ponder the culture, health, and literacy aspects of a health literacy discussion. Module 6 honed in on the key ethical principles involved in health literacy and public health practice. And then last week in Module 7, you actually learned how to write in plain language. And this week in Module 8, we are concluding by discussing the impact of improved health literacy from a public health perspective. And in conclusion, as a public health professional, I sincerely hope that this course has helped you to prepare for your career as well as your future in the program. In your career, you will be expected to speak to diverse audiences, which will include laypersons, patients, as well as more sophisticated academics and healthcare professionals. To do this effectively, you will need to understand what is appropriate, and you will always need to consider what's the best way to communicate. Congratulations on completing this course, and much success in your future with public health.